Okay, so I am here making a video because I have been researching this subject on YouTube, hoping to find other videos, and have not found anything that is really worthwhile. Um, I was diagnosed with breast cancer. I've undergone my biopsy. I went and had a lumpectomy done. And now I've had the decision of whether or not to have chemo. I was hoping to find other YouTube videos for other people going through the process, what they went through to make their decision, um, even what they went through with chemo, to see if that helped me to make up my mind, and could not find anything that was really relevant. There were a lot of "this is chemo" kind of videos, but they were more from cancer associations and things like of that nature, not personal videos. So I decided maybe I should do one. I don't know. We'll see if it ever makes it to YouTube. Okay, so I landed in the gray zone on the genetic testing that was done. So I was right in the middle. I could either have chemo or not have chemo. It was pretty much up to me. I know the decision is always going to be up to the patient. You know, you can, even if you land way in the black zone where you have to have chemo, or they suggest that you have chemo, you still have the decision to walk away. But I was right in the middle in the gray area, where it was like, you know, the odds are like only so much better if I have chemo, but I could still have the probability of not having a cancer recurrence if I don't have chemo. So I had to sit down and make the decision. The one thing that kept coming back to me was, so what if I don't have chemo and in a few years the cancer comes back? Then I will have I'll start playing the woulda shoulda game in my head. You know, what if I had had chemo? Then I wouldn't be here, or I might not be here. So I decided I will have chemo, which I just made the decision really last night. So it could change, who knows. But there were a lot of things to look for in my decision, because not only do I have the breast cancer, but 2 years ago I had bariatric surgery. And so this puts my system a little bit below other systems, whereas it might be easier for me to get an infection. It might be easier for me to get the nausea and vomiting that some people might not get. And if I do get it, it might be worse. But there are no certainties. I might be one of those people that does not get those side effects. And so it's really up in the air. But the thought concerns me that because I did have the bariatric surgery, that things could really go down south bad, or go south fast. And so it was a big decision for me. The hair loss is always, you know, we all look at that, I think, and, you know, well, I don't want to lose my hair, you know, but it's a temporary thing, so I suppose I can deal with it as well as the next person. The risk of infection is scary. Again, because I had the bariatric surgery, my risk for infection might be a little bit higher than someone else's. The nausea and vomiting really scares me because of the bariatric surgery. My stomach is only about that big, about the size of an egg. So there's not really a whole lot in there at any one time, and it doesn't take much to fill it up when I do eat. So I guess we'll see how that goes. I will continue to make these videos. I don't know if any of them will actually get uploaded to YouTube. If you're watching it, it will have been uploaded. I will continue to make the videos throughout the process because I think something does need to be posted that shows what people go through when this happens. You know, you get told you have cancer. For me, my breast cancer was found through a mammogram. I did not have any lumps. I have fibrous breasts. I did not feel a lump. It was just a normal annual mammogram. I'm 56, so I've been having them annually for several years now. And because I have a new healthcare provider this year because I changed jobs. And so when I got called back for a second mammogram, I assumed that they just needed a second look to confirm, because as I said, I have the fibrous breasts, and the last time I switched healthcare providers, they had to take me back in for a second look just so they would have the comparisons. And I assumed that was what was happening this time. And after the second mammogram, I got a call. And they said, well, I'm sorry to tell you, but you have cancer. And so I'm on my cell phone in the hallway at work. I stepped out of a meeting to take the call, and I was just floored. You know, this is not TV. They don't call you into their office and let you down gently. It's just a phone call, bam, you have cancer. We're setting you up for this appointment. It's at this and this and this, you know, this date, this time. You have to be there. And so it's like, you know, I mean, I'm in the hallway on the phone. And so the next thing was the biopsy, and I guess there was an appointment in there somewhere. They sent me in for an appointment and a biopsy, and it's all so muddled at this point. It's kind of hard to remember. I should have started these video series earlier. But the biopsy itself is a very strange thing. It's not as painful as I thought it would be. I would not be afraid of the biopsy. They do some local anesthetic in the breast, and then they do something with it sounds like a big plastic stapler. To be honest, I didn't want to look, but it sounds like a big giant plastic stapler going when they pull out the samples. And so then after the biopsy, it was a few days, I guess, before I got the results and was sent to a surgeon, or back to the surgeon to schedule I was sent to a surgeon to schedule the lumpectomy. Or, you know, at that point, you don't know if it's going to be a lumpectomy or total mastectomy. You don't know how deep it is, how far, how wide, how anything. But for me, I was lucky. I was fortunate enough that it was located in one area of the breast. It was fairly easy to get to. It didn't look like my lymph nodes were affected. They did, in the lumpectomy, they did take out one lymph node just to be sure. They take out the closest lymph node, and as long as that one's negative, then they don't go back in to get more lymph nodes. So I got lucky on that. That was negative. So then after the lumpectomy, which has left me with this baseball size, I forget what they call it, cystoma, I think. Then I had to make the decision to go for chemo, to not have chemo, you know, so I requested the genetic testing to help me make a better decision. it also helps direct them as to what type of drugs to use as to attack the cancer. So then after the chemo will be then radiation therapy. So I think we're looking at about 6 months of treatments total, if I remember right. As I said, everything kind of gets fogged in. It's really good if you have somebody go in with you to these appointments and write things down, because your brain, well, at least my brain, is in such a fog that I think I remember things, but I'm not quite sure if I'm remembering correctly. I did get lucky. I went to see the oncologist last week, and she actually wrote everything out for me. She pretty much made a Venn diagram of what would happen from this point on. You know, if you choose chemo, and then we'll do this and this and this, and then if you don't choose chemo, we'll do this and this and this, and that helped. So that's where I am right now. I'm in between. I've elected to do the chemo. I still have to go through a pre-chemo, like a class or something. I'm not sure exactly what they do. They put you in with where you can go over everything with the pharmacist and the I don't know exactly this part of it. So I'll find that out within the next couple of days when I go to that, and then when I start my chemo, and I will try and keep posting on this and see how it goes. I'm not the great finisher on things. A lot of times I get all jazzed up and yes, I'm gonna do this. This is gonna be great. And then I lose interest and it goes bye-bye. I've started a couple of blogs like that, and yeah, so we'll see. All right, so hopefully this will help somebody else out there make their decisions, or at least put them in the right direction to make their decisions. I was, like I said, I was very disappointed that I just wasn't finding anything out there about the process, the decision process, and the personal process that people were going through with the cancer therapy. And there were a lot of, yay, I beat cancer, I'm back. And there were a lot of, oh, I have cancer, I'm not going to be around for a while. But there was nothing in between. And so that's what I wanted to hit. And I keep thinking they must be out there, the videos must be out there. In this day and age, people videotape everything and post it to YouTube. But I couldn't find anything. So I thought I might try it. We'll see. All right, well, thanks for listening, and subscribe if you want to get posted on the next one. Thanks.